Good morning, everyone. Today I'm going to speak to you about fibromyalgia, and in fact, this is a subject that is, bothering so many patients. It is a syndrome or a disease where the patient is feeling widespread body pain problems. It's not necessarily to cover all parts of the body. It could be half of the body or a quarter of the body. But it's very important to know it is a clinical diagnosis and not a physical diagnosis, which means there is no specific test or blood test or scan going to show the diagnosis of fibromyalgia. Originally, I'll first discuss with the patients the history. The fibromyalgia has also not only physical symptoms, but there is psychological symptoms, and there is also biological symptoms. So there are many causes of fibromyalgia. It can come from out of nowhere. Suddenly, patient wake up with severe pains with no cause, apparent cause. It could be also caused by trauma, which is either physical trauma or psychological trauma. So if there is any form of upset or stress due to certain reasons, or abuse due to any causes, as you know, there are so many forms of abuse, verbal abuse or physical abuse or any form of abuse. These are all can cause fibromyalgia pain syndrome. The cause might be hidden since the childhood and the patient is not aware. And if you ask the patient, I'll ask them, they say no reason. But actually, when we investigate more and go deeper into the history, there could be a reason. So why fibromyalgia is so annoying? Because it can cause significant impact on the life and on the mental health also. In what way? I just wanted actually to first tell you, it's not only physical symptoms, as I mentioned, it is also mental health symptoms or cognitive symptoms. In what way? The patient will feel actually that fog in the brain, tinnitus in the ear, buzzing. He will feel also lack of energy. There is urinary symptoms, urgency with no urinary tract infection. It can also be irritable bowel syndrome with the fibromyalgia. Also, if you look at the other symptoms, the patient feel, I cannot do anything. I feel low. I feel my mood is not great, anxious. There are combination of physical and mental health symptoms can diagnose the fibromyalgia, not necessarily widespread body pain only. Now, I'm going to give you a very short awareness conversation about what is causing fibromyalgia physically. A lot of patients are told it is in their head, but it's not. In fact, it is caused because of the release of certain chemicals in the body and decrease of other chemicals in the body. I'll show you in this one a very small thing about how many nerves in your body. And this is the anatomy, and this is your body here. And if you look here, I'm going to add the nerves. You can see. So these are all nerves. See how many, all this yellow stuff is nerves. So of course, pelvic pain is very big issue, and it happens with fibromyalgia also. Back pain can happen with fibromyalgia, but that amount of nerves, and this is all wires, and I call them dysfunctional wires. When these wires are not working properly, fibromyalgia does happen. There are certain chemicals like serotonin and norepinephrine. These are called inhibitory neurotransmitters. They are decreased in the blood levels, but we don't measure them for fibromyalgia. There is no test, as I mentioned. It's only used for research purposes. And other chemicals like substance P and glutamate, they are increased level in fibromyalgia. Among hundreds and hundreds of chemicals that increase and decrease and causes fibromyalgia. So what is the treatment? In my clinic, I offer medical treatment and lifestyle advice and changes, and of course, lidocaine infusion. There is lidocaine with magnesium infusion, and there is lidocaine with ketamine infusion. And these are all treatments, not really cure from fibromyalgia. There is no cure. It is a disease like hypertension and diabetes, a chronic disease. But these things can help significantly to manage the pain and to give you a respite for about 3 months to have some relief. And then patients come, either repeat medication or repeat the infusions or follow the advice. What is my job here is really to cut down the vicious circle between these nerves and your brain. The brain is the stimulating for the fibromyalgia, and all of these nerves are stimulated by the brain. My job is to cut this vicious circle, but by pain management techniques, I cut this vicious circle, hopefully, and I advise you what to do to rehabilitate your body, and over time, it will help significantly with the symptoms. Thank you very much for watching me today, and I hope you to contact me if you have any question. My website, www.drmonamubarak.com, or my Facebook page. You can reach through email or via WhatsApp. Thank you and goodbye.